let's get on with the introduction. So the second most common pediatric fractures and prone to various complications, various deformities can occur. And it is a growth plate fracture. So the classification is basically intended to assess the stability of the fracture, which will guide us with the treatment. And unfortunately, assessing the stability is done at two stages. One is at the time of presentation, and many of these fractures do displace late. So we want to be able to predict the stability after a few days or 1 week. So that is the aim of all these classifications. So there are various systems in place. These are the few classifications that are in use, and they have each been developed over the period of many decades. You're all familiar with Milch. So for each of these classifications, I have put a line which is the main focus of this classification. So when Milch was developed, the main idea was whether the lateral flange of trochlea was intact, and that decided stability. So the idea of stability was there from that time itself, and Milch classified it into 1 and 2. So basically 1 means it is a more stable type where the trochlea was not violated, and 2 where the lateral flange was violated and potentially the elbow can translocate. Then Jacob improved on this, and he suggested it as 3 stages when by noting that there was actually an intact cartilaginous hinge which provides some stability. So stage 1 is that there is a hinge which is intact. Stage 2 is that the hinge is breached, but still it is not rotated off, and 3 is where it is completely rotated. So it's quite clear that only the stage 1 is actually stable. But Song, which is currently the most favored, is classified it, and I will, the Jacob which I referred to earlier, and Finnbogason, which I will talk about next, he actually combined those 2 classifications to make this. So he has divided it into 5 stages, and I will just move on to the image. So the first one here is that there is a lateral opening, but there is a very indistinct medial end point, and this is a stable fracture, and you can take the X-ray. The internal oblique X-ray also will show that there is a medial indistinct endpoint. The second Song stage is that there is a definite endpoint. It is exiting, but it is still stable, and the gap is less than 2 millimeters. Third is that it is exiting all the way, but it is still stable, and the lateral and the medial gaps are of the same width, and this is when it starts to get unstable because your cartilaginous hinge has been lost. And then fourth, obviously, that there is a rotation element, and fifth is that it is completely rotated outside. So this is Song's classification, and the last 2 you can see that the displacement is more than 2 millimeters, and 3 is where things starts to get interesting, and 3 obviously sits in that gray area where you are not really sure on the first day whether you have to go ahead with the conservative or operative. And this is where Finnbogason was keen to define the 3 of Song. So he took it up just the 3, and he said that this is not up to the epiphyseal cartilage. It is up to epiphyseal cartilage, and the gap is as wide medially as laterally. So he divided this thing into 3 finer subtypes. But that still didn't give us enough guidance for what we are supposed to do when we see a fracture, whether we want to predict what will happen after a week or so. So this has been found to be a reasonable predictor of this. And here we're going to take an AP view, and if you see that there is a medial fracture line which is as wide as the lateral fracture line, that indirectly indicates that the hinge has already been lost. So once the hinge is lost, it is technically unstable. So these are the fractures you would advise a second X-ray at 4 days. So that is Hassler and von Leer classification. So then there is an additional classification which is just like our AO classification, just depending on the extent of displacement, whether it is 2, less than 2, equal to 2, or more than 2. And this is the Weiss classification, and that is just to see whether to fix this fragment or not. So the comparison of systems, these are the few classifications, and all of them talk about stability. The displacement is talked by everything else except Milch. Treatment, whether to pursue a conservative course or to operate, whether to offer a predictive value. The last two is more valuable. And complications, whether this fracture will displace, unite in a displaced way, whether you have to do a fixation, because remember this is a physeal fracture. All that is dictated by Weiss classification. So in conclusion, each of these classifications will have a particular focus. And mostly, as far as lateral condyle is concerned, the focus is on stability and predicting whether a fracture will displace in a week's time, or whether to go conservative, or is okay to call the child back after a few days and take a repeat X-ray to see whether you have, it has displaced, whether to do closed reduction pending, whether to do open. So all those questions are being tried to answer, and all that depends on the cartilaginous hinge, which is intact, and they're basically trying to identify that. So right now, what classification which could predict it is the Hassler and Wandley are the last classification. So thank you. This is a short presentation. I think hopefully it will set the stage for the next ones. Thank you.